Hey guys, I get the question all the time, what is a degenerated disc? So in this video, we're going to talk about what the disc is, what its job is, why it degenerates, because there's always a reason, and what we can do about it, and how correctable is it once it is degenerated. So your disc is an amazing thing. We learn in school, at least I did, in elementary school that is, that the disc is a shock absorber. If your disc is your shock absorber, you're in very big trouble. The job of the disc is it's called a force transducer, and what it does is it allows movement to happen in the spine, and it does somewhat cushion the joints of the spine, but if it's a shock absorber, you're in very big trouble. The shock absorber of your spine is the curves of the spine, just like your knees. You do have a meniscus in your knees, which is like a disc, but if my knees were locked totally straight, like if I had a full body cast from my chest all the way down to my toes and I had to go down 30 flights of stairs, I probably have a problem in my knees by the time I got to the bottom of those stairs, right? The flexion of the knee is the shock absorber of the knee. The same with our hips, same with our ankles, and the same with our spine. We're supposed to have three opposing curves in the spine, one in the neck, one in the mid-back, and one in the lower back. The most common area to have a degenerated disc is in the lower back, the lumbar spine, although the neck is also very common. So discs degenerate because the spine is misaligned. So the normal spine in any x-ray, 99.9% of our patients, we x-ray to determine their actual mechanics of their spine. So this green line here is normal. Don't know how you can see it on the video, but it's important to know that there is a normal. The red line is where this patient is. And so the red line shows us that the patient's spine is translated posteriorly. We call that a negative translation about the z-axis of the thoracic spine. Our group of chiropractic biophysicists categorizes these so we can actually correct them. But so she has a big translated posterior thoracic spine. It's shifting, it's creating shear on the disc, especially this L4-5 here. So the disc, the vertebrae should be lined up on top of one another. So this is sliding backwards. So all these fibers here, if you can picture that, are being sheared and torn upon. They're also being smashed because no longer does she have this normal curve. She has a reverse curve in her lower back. It curves the wrong direction. So instead of that easy flexion, it's jamming and cramming and creating stress, shear, and compression every single day on those discs. It's a recipe for failure. So what's going to happen is over time, they're going to degenerate. So whereas normally, these are two vertebrae. Let's call this L4 and 5 because in the lower back, this is the most common disc to have a problem. So the disc is like a wet leather washer that holds the bones apart. It's this amazing, miraculous design. The fibers of these discs are lined up to create multiple 30, 60, 90 triangles, the most stable structure in the universe. God created you brilliantly. These can take a lot of stress, but they can only take so much stress. So what happens is when they're lined up and when the curve is taking shock from jumping, running, sitting, standing, doing all the things that we do, these discs stay very healthy for a very, very long time. And when there's movement in your body, it's an amazing thing. These discs, they don't have a direct blood supply, so they need nutrients from the bath of the spinal fluid and other fluids around them from blood near there. The disc actually pulls fluids in through here, and it's supposed to circulate through what's called the end plate of the vertebra. The bottom and top of these vertebrae, they're actually like a sponge. It's a matrix where fluid flows in through the disc and in through the vertebral end plate through here and then out through the vertebra itself. It's supposed to flow like that when there's movement. Now, if the vertebra is subluxated or misaligned, and that can be just one or two segments that are shifted out of alignment, like this, compressing one side, or could be from rotated on the x-axis, compressed like that, then it's going to create abnormal forces on this disc, and the disc itself will degenerate. Why does it degenerate if it's such a perfect design? Well, it is a perfect design, but let's picture that you're sitting on the ground and you got an elephant sitting on your chest for 5, 10, or 15, or 20 years. You can't breathe very well, right? So your lungs are going to compress. They're not going to function as well. and eventually your ribs are going to break. You're going to have all sorts of problems from that elephant. So with this compressive load here, like that, new pen. Thanks, Christine, for having another pen there. So with a compressive load just like that, compression here, and even shear loads on this disc, there's only so much they can put up with. It's creating a lot of stresses on those joints. The discs are going to degenerate. So as they degenerate, this fluid flow through here slows down or even stops, and the discs don't get the nutrients that they're supposed to have. The discs will collapse and degenerate. These end plates here, they become scarred. They become literally a scar tissue. They become thicker, and we stop that normal fluid flow through the disc and through the end plate of the vertebra, and over time they degenerate worse and worse. So it's a major problem. This is the reason why people get bulging discs, because of those shear forces, the degenerated discs. It's a major problem, creating a lot of pain, and it will cut off life through your nervous system. The whole reason that we chiropractors exist is because life is generated in the brain, flows like a river through the spinal cord and out through the nerves that go between the bones of the spine. This is what brings life to every cell, tissue, and organ in every single vertebrate's life and body. We want power to the reproductive system, to the liver, to the heart and lungs, to the immune system, to the digestive system. This will cut off life to that, as well as cause pain. We don't want any of that. So what do we do about it? As doctors of chiropractic, in our specialty, chiropractic biophysics, the most scientifically proven method to correct these things available anywhere that I know of in the world, what our job is to restore the normal mechanics to not just this one joint. Traditional chiropractic is very, very valuable in that if a vertebra is twisted like that, then we're going to untwist it as a traditional chiropractic adjustment. But what we're going to do very rarely are just two vertebrae displaced. In this case here, the whole spine is out of alignment. She's got kind of the Shaggy from Scooby-Doo posture. So we got to correct that. We're going to correct it with the right exercises, the right adjustments, and the right traction. She can't just strengthen her core. If she strengthens her core, like almost every trainer, and we hear a lot of people saying, oh, you just have to strengthen your core. You don't want to strengthen it where it is because it's out of alignment. We got to get it shifted to where it belongs. Then that's going to take a lot of this shear off and correct the posture. So we exercise, then adjustments that correct that in the mirror image. So if she's here, we got to bring her here with her exercises, with her adjustments, and with her traction, specific tractioning for 15 to 20 minutes, 3, 4, 5 times a week of getting the spine back into alignment. And then at home as well, on special den roll blocks, we're going to work to correct the alignment so the cause of it is gone. So I very often get the question, can it be fixed? Well, once there's degeneration, there's always going to be some degeneration. That's why it's so key to take care of kids from when they're tiny, raise them up in the way they should go, and when they're older, they won't depart from it. That's the way it should be. We want their whole spines in proper alignment right from the very beginning. But once there's some degeneration, there's always hope. We can always move it some, but it's so much better to start earlier. So the best thing when someone comes in 62 years old and they say, oh, the pain just started yesterday, doc, and I do an x-ray on them and you can tell their spine's been degenerating for 34 years. Usually we can tell within 3 or 4 years how long ago the misalignment occurred. So we're going to be able to tell how long ago it occurred, but the ideal thing is bring in your kids and your grandkids before they get this degenerated. But we always can help. I've never seen anyone that we couldn't help. Now, sometimes people may need a surgery. They've let it go too far, but they should take care of their spine before and after that surgery. And we do work with surgeons to be able to refer when necessary. So those are the ins and outs of a disc. The best advice I can give you is take care of yours as early as possible. But if you are having pain or problems, let us properly evaluate it to see exactly what the cause of the disc is, because where one person's posture is this, we need to correct that. It's not the same for everyone. Literally, other people have the opposite problem with the same resulted disc problem. So we need to correct whatever their posture is. So I hope that helps you understand what a degenerated disc is. As always, if you have any questions, let us know and we'll be happy to get back to you. Have a blessed day.